Hi, I'm Rob Murray. I'm a colleague of Dr. Samantha Murton at the College of General Practitioners. As many of you will know, Sam's actually finishing up her medical director role shortly. Let's find out why. Sam.
Yep, I've been in the medical director role for 2 years now, and it started off as I was the first medical director. So it's been a process of establishing the role and making sure that having a clinical person on deck and on the floor in the college is well established, and people use me a lot. So it's been a really great job. I've integrated with all the teams that are in the college and done a lot of work with policy and with the membership services and with the chief executive and also with the board. The training program has colleagues of mine in there anyway, so they continue to work and I liaise with them. And so it's been a really great job. It feels like it's the normal now, which is great. And I have some other things that I'd like to pursue myself.
Such as?
So, yeah, so the reason I've stepped down is because I've written a book in minor surgery. And
free ad there?
Yep, free ad. And then also I want to look at doing some patient information stuff. So, like most GPs, we have a lot of patients who come in and they really aren't getting what we talk about, because we probably talk at the I've been to university level, and we understand health and how it works really well, and trying to get that message across to people who really don't understand how health and your body works is actually quite tricky.
So if I come in with a bad back, what might you say to me?
So the thing about me is I might say some things, but I might also draw some pictures. So since I like doing art, I will draw you a diagram of what's going on with your back and draw you little stick men about what exercises and things that might be helpful. And so all those things that I've talked about for years with patients, I've kept in books, and I have collated a whole lot of those stories together and worked out which are the commonest things that I say. And I've put, at the moment, there's 25 of them on video, of which I've got probably 60, and there'll probably be more. So,
have you also made a list of the things you shouldn't say?
There probably are things I shouldn't say, and usually trying to crack jokes with patients is not ideal, but it often breaks the ice. So there's nothing on video, hopefully, that I shouldn't say. They don't record me in my practice though.
Okay, we wouldn't do that.
No.
Okay, and you will be seeing more patients now, of course, so you're going back to do how many tenths?
Well, I'm actually, my practice thinks that I'm going to be doing more, but actually I'll be doing half a day more. So that means I'm doing 3 days a week, and but the meetings that would normally have ended up on my clinical days won't be happening so much, so they'll be pleased. I said to a patient the other day who was complaining that he could never see me, I said, I've resigned from my job just for you. And but
so he can only come on a Wednesday afternoon?
Yeah, only Wednesday afternoon, So it means that the practice will have more time. I can focus on that whole sort of practice focus stuff, and if I didn't do these things now, they'd probably just left on the back burner and never get done. And so it's a really good chance to sort of get out and do some stuff, test the water, and then see what else I come back into. I'm sure there'll be other things that I end up doing that are in the roles that I've had, and I'm continuing to work with the college on their self-care document as well.
Oh, right, yeah.
So.
Okay. College is looking for a new medical director, unfortunately.
Yeah.
What advice would you give that person?
I think it's a fantastic role. It's a really great role. It's really been well received by colleagues, and I felt incredibly supported by the colleagues that are there. There's been genuine support within the college and the staff for the stuff that I do with them, and it's been fantastic working in the sector as well on different committees and meetings, and you end up being a port of call for lots of people, and I think it's morphed into a bigger job than I had thought it would be. I think in that respect, then whoever comes into it will need to make it their own in that way, but also work out what are the things that are the key focus for the role.
How many free consultations on staff do you think you've done in the last 2 years?
I've probably done about
done
5
about
or 6.
Done 3 or 4 on me. So
I occasionally have the sort of like whip up the trouser leg, can you look at this doc? And does this cream work? And a few of those other things. And is my cough getting better? So I try not to do too many, but the occasional consultation.
You know you're going to be missed, don't you?
Oh yeah, I know that.
And you know you're going to come back and everybody will love to see you again.
Yeah, they will.
Okay, cool.
So I'll be back.
We're done.
I'll be back.
We'll be back. We're done. But have you got a joke for us?
I have no jokes. The only joke I have is about one of my patients who I think wanted drugs from me, came in one day and he said to me, oh, did you hear that joke about the guy who thought he had some lettuce in his ear? And I said, no. And he goes, the doctor looked in his ear and he goes, that's only the tip of the iceberg.